Many of the passengers arriving at Heathrow from Beijing this afternoon were wearing masks, even though the Chinese capital has escaped the worst of the virus's spread. And this afternoon, the government reassured MPs that it wasn't taking any chances either.
This is a new disease and the global scientific community is still learning about it. I have therefore directed Public Health England to take a belt and braces approach, including tracing people who have been in Wuhan in the past 14 days.
The Health Secretary said that people who'd arrived from Wuhan in the last 2 weeks should isolate themselves and dial 111 for advice. And anyone still in the city who's brought back to the UK will also be kept in isolation. There's been no person-to-person spread of the virus outside of China, but experts warn a pandemic is still a possibility. The latest estimates from China is that each case of the virus is causing between 2.5 and 4 new cases, and up to 3% of cases are fatal. But compare coronavirus to measles. Each case can cause 16 others, and it can be equally deadly. But we have a vaccine against measles and not coronavirus. At least not yet. This lab at Imperial College has pioneered vaccines that are based on the genetic material within a virus. They started working on a Wuhan vaccine as soon as that code became available 10 days ago.
It gives us a lot of advantages. First of all, we can make that sequence through a synthetic process. So unlike traditional approaches to a vaccine where you might be growing the virus in cultures, maybe in thousands of litres to make enough product, we can make it synthetically in a few litres and make 1 million doses, theoretically. So we can move very fast in ways that have not been previously achieved. And so that's a significant advantage.
This team thinks it could have a vaccine in human trials within 4 to 5 months. But if efforts to contain the virus are successful, we'll hopefully never need one. Tom Clark, ITV News.